If you're turning 65 or about to enroll in Medicare for the first time, then this might be the most important message you've ever heard. Here's why. Did you know that over 11,000 people are turning 65 every single day for the next 18 years? That's one every 18 seconds. Most retirees will no longer be getting a paycheck. Some of the fortunate ones may be eligible for a pension or retiree medical benefits. But for most, those days are long gone. Listen, for 90% of retirees, every penny counts. According to the Social Security Administration, 96% of Americans are not able to fund a retirement that will last for their lifetime, allowing them to live the lifestyle they wish to live. Pretty scary stuff when you think about it. Did you know why this is? Well, it's because most people don't properly plan for their healthcare costs in retirement. They don't understand their Medicare options, or even worse, they don't understand how Medicare really works. Meet Bill, one of our clients. When I first met Bill, he was a few short weeks away from moving out of his home. As I walked in, I noticed packed boxes all throughout his kitchen and living room, and as we got to know one another, he shared his heartbreaking story with me. Bill's wife, Mary, was diagnosed with cancer in her early 50s. Because of the severity of her condition, she was no longer able to work and forced to go on disability. Bill shared with me how he was burning the candle at both ends. In addition to working a high-profile, demanding corporate position, Bill was managing Mary's care, taking her back and forth to treatments and doctor appointments. At the time, Mary was covered under Bill's group health plan, but unfortunately within a short period of time, her expenses exceeded the lifetime maximum and she was dropped from the plan. Bill was forced to rely on personal savings and retirement to pay for Mary's medical bills. Fortunately, Mary had been collecting a federal disability benefit for over 25 months, which made her eligible for Medicare. But as Medicare only covers 80% of expenses, Mary needed additional coverage. She decided to enroll in a Medicare Advantage plan, a type of plan that typically has a lower premium, copays, and deductibles, and provides access to a managed care network. Mary was initially attracted to the plan because of the lower premiums and a friend's advice, but soon found out that lower premiums sometimes are a double-edged sword. Mary found that the best doctors for her care were not covered under her provider network. Like most people, she didn't understand the provisions of her coverage. She didn't understand the difference between a local and a regional provider network, or the difference between an HMO, PPO, PFFS, and a POS plan. Most people don't understand the terms of insurance. They just want to know if they get sick and need to get the best care, it's available to them. Who wants to worry about doctors and networks when all they want is for their loved ones to get better? When you're healthy, a Medicare Advantage plan seems like the more attractive option. And for some it is, but you should always weigh the good with the bad. Unfortunately for Bill and Mary, it was not a viable option. Before Mary passed away, she had gone through multiple treatments, skilled nursing facility confinements, and home health care aides assisting in her care 8 hours a day, 7 days a week for 3 years. The expenses literally exhausted her out-of-pocket maximums for the year on her Medicare plan. Mary's home health care aide visits alone cost over $1,500 a week or $6,000 a month, totaling over $72,000 for a year. These visits, along with other uncovered expenses, continued for over 3 years. Bill was forced to liquidate the $700,000 he had in his 401k plan and the equity in his home to cover all related expenses. In the end, all Bill wanted was to provide the proper care for Mary before she ended up passing away in hospice. I wish this story had a happy ending. As I finished up with Bill, I could sense his sorrow. It was the last 2 days in his house before he and his daughter had to move everything out. Why? Because their home was going into foreclosure and Bill and his daughter were forced to relocate to a small apartment. His daughter withdrew from her studies, no longer having the financial means to finish her college bachelor's degree. As you can see, the story clearly illustrates what happens when you take advice from the wrong people and end up with the wrong Medicare coverage. It could literally bankrupt you in retirement. For far too many people, this is a familiar story. My name is Lenore Mazenko, and I've been working in the employee benefits industry with people just like you for close to 30 years. After working with companies like Coca-Cola, Kraft Foods, and Great Bar Electric, I know how confusing benefits can be. Medicare is especially confusing. That's why we've created a step-by-step, down-to-earth video series called Medicare: The Inside Scoop. We wanted you to have an easy to understand guide that cut right through all the baloney and told you the biggest Medicare mistakes retirees make, and more importantly, how to avoid them. You need to know how to avoid little known mistakes that could cost you a fortune in retirement. Sign up now and you'll get instant access to our 7-part video series, Medicare: The Inside Scoop. Unlock the information you need to make the best decision for your coverage. Submit your name and email to the box to the right, and you'll get instant access. Here's what you'll discover when you get the inside scoop on Medicare: how to take the guesswork out of enrolling in Medicare, how to quickly and easily understand the parts of Medicare, what every boomer ought to know about receiving their Medicare benefits, Medigap versus Medicare Advantage, the truth about Medigap plans, what the big insurance companies don't want you to know, why now might be the right time to enroll in Medicare, 3 simple steps to getting started in Medicare, 7 common misconceptions about Medicare, and much, much more. Here's what others are saying. It's like having a mental vacation from stress. We now know if we have some serious issues, it can be taken care of. Neil M. in Newton, New Jersey. She, Lenore, was extremely knowledgeable and helpful. She made it very easy and answered all the questions that I had, and I would highly recommend her. Kathy W. in Hamburg, New Jersey. I sat down with Lenore and she went through the benefits of it, meaning a supplemental plan, and little did I know how much it was doing to help. I started seeing doctor after doctor, and thanks to Lenore, things have been wonderful for us, and I thank her from the bottom of my heart. Barbara M. in Newton, New Jersey. She went over all my needs. I highly recommend Lenore if you have concerns and want to get good insurance. Fran P., Mount Olive, New Jersey. I looked at Medicare, but I was confused with all the options available. A friend of mine recommended Scott, and he really explained everything to me, and I really appreciated all the help he gave me, and I highly recommend him. Ron W. in Kingston, PA. I'm thrilled. Even my doctors were amazed that I wasn't responsible for copay or coinsurance. If you have any issues, call Lenore. Walter B. in Sparta, New Jersey. Lenore was awesome. She came to our home, sat down with us, and showed us how we would save over $700 a year just by switching Medicare supplement insurance carriers. Ed and Mary W. in Rockaway, New Jersey. So here's what you need to do next. Submit your name and email to the box on the right. Click the orange button that says, "Yes, I want instant access," and unlock the information you need to get the inside scoop on Medicare. Remember, your email is 100% secure. It will never be shared or sold. And you can unsubscribe at any time. Submit your name and email now. Remember, we're not sponsored by any one insurance company. What are you waiting for? Get started now with the inside scoop on Medicare.